The next one is something called leaky gut syndrome. So in the gut, there's a couple different, I guess you could see areas of the gut or layers of the gut. So the first is the inside of the tube. So that's like would be if you're looking down a hose, it's the inner part of the hose where the water flows. So that for us, that's where the food is at. And we can get other things in there. We get food material, partially digested, fully digested foods. We can get bacteria, yeast, fungus, parasites, a variety of things. So that's in that first area inside the gut. Then we have what's called the mucosa layer. So if you're looking at the inside of that hose on the inside, if you can imagine there's a protective layer there, that's the mucosa layer of the gut. And that prevents food and other things from interacting with the next layer, which is, I guess you can call it the skin of the gut. So that is the actual barrier between the inside of the gut and then moving outside of the gut into the bloodstream. So there can be a breakdown in any of these areas. So usually it starts first with we don't have enough good bacteria, or we eat foods like we talked about earlier about food intolerances. That causes an irritation. It causes a breakdown in that mucosa layer. So now more things can touch the skin of the gut or the surface of the gut lining. And then now when it does that, especially certain foods like gluten, for instance, is a common one, we start to get irritations on the wall of the gut, and then it starts to break down that lining. And the problem with that is the gut is like one big filter. So the analogy I like to use is a screen in the window. So we have a nice day in the spring. We want to let fresh air in, but we don't want to let bugs in. And we don't want to let other things get in through that window. So the screen is there to let the air in, but not let the bugs in. So in the gut, that layer, the skin of the gut, is when that starts to break down, those holes in the screen start to get bigger. So now it's like taking a screwdriver and jamming that through the screen. So now we're letting air in like we want, fresh air, but now those holes are larger than they should be. So now other things can get in, mosquitoes, gnats, flies, etc. When that happens to the body, it's kind of like what happens in the room here. If I get a bunch of flies in here and I start swinging around, then I can start knocking things over and start causing some damage. In the body, the immune system does that. So the immune system sees things that shouldn't be there, starts to go on the attack, and that creates an inflammatory state and then can start to cause issues all over the body, really, but especially at the level of where it's all happening at the gut lining. So then that can cause some irritation. It can cause some pain. And then if the mucosa layer is broken down, it creates an unfavorable environment for our healthy gut bacteria to thrive, and it just throws off the way the gut functions. So that's root cause number 3 is leaky gut syndrome. We can also call it increased intestinal permeability. Those gap junctions, those holes that are supposed to let nutrients in but keep everything else out, they get too large and then starts to cause all of those issues from happening.